Hello future doctors, how are you all? Welcome back to MedSteps ECG Series, day 17. So in our previous lecture, we have learned about sinus bradycardia and sinus tachycardia. So today we are going to learn one of the most important high-yield common cardiac arrhythmias in the world. That is atrial fibrillation. This is an extremely important topic if you are preparing for MBBS or end rotation exams in internal medicine and cardiology or emergency accidental emergency department. So everyday clinical practice, by the end of this lecture, you will easily recognize about atrial fibrillation on an ECG and understand why it can cause stroke. So without time waste, let's begin. What is atrial fibrillation? Normally, the SCA node produces one electrical impulse. So the atria will contract in an organized way. So here the atrial fibrillation, hundreds of abnormal electrical impulse fire rapidly and chaotically within the atria. Okay, so instead of contraction effectively, the atria simply quir like a cure, that means fibrillate. Okay, in imagine an orchestral, imagine for example if you're seeing any chorus, we can see some orchestra. So normally one conductor directs everyone. Okay, that conductor is SA node. So now imagine 100 people conducting at the same time, the music becomes completely chaotic, right? So same to same in heart also the current will pass like that. So that's why we call that is atrial fibrillation. What happens in atrial fibrillation? So normally the heart rate conduction we can see SA node, then after the current will pass to P wave, then after regular QRS complex. In atrial fibrillation, the patient will get multiple abnormal atrial impulses and no organized atrial contraction, then after irregular ventricular response, then after irregular heartbeat, the patient will get. Okay, so in ECG features, whenever you are seeing ECG, you can see this type of rhythm. You can see this is the most important part. We have to look for three classic ECG findings. So first one, no P wave, means normal P waves are absent. Instead of instead there are tiny fibrillatory F waves or at a wave baseline. Okay, so for example, you can't see any P wave here. Okay, along with that you can see the baseline will be like one is up, one is down, like that you can see. Okay, so this is the thing. Next you can see irregular rhythm. So here till here more distance, till here less distance, like that irregular rhythm you can see. So this is the hallmark of atrial fibrillation. The R interval are completely unpredictable and no repeating patterns. Next you can see narrow QRS complex. In narrow QRS complex, usually less than 0.12 seconds, unless there is a bundle branch block or another conduction abnormalities. Okay, so we have some high yield rule for like no P waves and irregular rhythm means that is atrial fibrillation. Why is the rhythm is irregular? The AV node blocks many of the abnormal atrial impulses. Only some impulses reach the ventricles. Because this happens randomly, and randomly the ventricles beat at irregular intervals. Okay, so this is multi atrial impulses the patient will get. The patient will get at a time. Okay, then patient will get random impulses pass through AV node. Next, you can see causes of atrial fibrillation. In causes of atrial fibrillation, we can see two different types of causes. One is cardiac causes and non-cardiac causes. In cardiac causes, we can see hypertension, coronary artery disease, heart failure, mitral valve disease, especially like mitral stenosis, narrowing of the mitral valve, next cardiomyopathy. So these are the main cardiac causes will cause atrial fibrillation. Next one you can say non-cardiac axis, non-cardiac causes like hyperthyroidism, alcohol, like alcohol means holiday heart syndrome we can see, and sepsis, pulmonary embolism, pneumonia, and common chronic obstructive pulmonary disorder. So these are the main, you can see, non-cardiac causes. So for remembering this thing, we have one memory trick, that is AF. AF heart. AF means atrial fibrillation causing causes, that is heart mnemonic. First one, H means hypertension and heart failure. E means endocrine, like hyperthyroidism can cause atrial fibrillation. A means alcohol because of holiday heart syndrome. Next, R means rheumatic mitral valve diseases. T means thromboembolism risk and thyroid diseases. Okay, so what are the symptoms you can see in atrial fibrillation? First one, normally patients may complain of palpitations, fatigue, dizziness, shortness of breath, chest discomfort. Some patients have no symptoms and atrial fibrillation is found incidentally. Why is atrial fibrillation is dangerous? Because you can see here, the atria don't contract effectively, so the blood can stagnate, especially in the left atrial appendages. Whenever the left atrial appendages, this increased risk of clot formation. So whenever the clot formed, um, if a clot travels to the brain, then we call that is ischemic stroke. So this is why anticoagulation is important in many patients with atrial fibrillation. So we are following one criteria we called chart VASC score. Okay, so this chart VASC score, it will help to management. It will help to manage atrial fibrillation with the warfarin or aspirin anticoagulants. So the chart VASC score will guide. So that's why anticoagulants is very important for atrial fibrillation. So for example, when I'm doing accidental emergency department, that time I saw one patient. The patient, like around 72 years old man, presents with palpitations. The ECG shows no P waves, irregular rhythm, and the patient, we can see narrow QRS complex. Then with ECG directly we can tell patient have atrial fibrillation, but patient don't have any symptoms. Just patient have only palpitations. So we can differentiate, we can diagnose properly with ECG. So that's why that ECG is very important. So whenever patient have atrial fibrillation, how we have to do management? So the initial management we can see is the patient. First of all, we have to ask ourselves, the patient is stable or unstable. Okay, how long has the atrial fibrillation be present? Because the atrial fibrillation, we can say, like we have it will divide into three different phases: persistent and acute. So these are the things. Based on the duration, we have to differentiate. What is the stroke risk? Okay, so we have the treatment options we have include like rate control. We have to control the rate with beta blockers like metoprolol or bisoprolol, or certain calcium channel blockers in appropriate patients. And we have to control the rhythm in selected patients. And we have to start anticoagulation to reduce stroke risk when indicated. So we will discuss atrial fibrillation management in detail in our um, okay, actually, I did internal medicine series. In that internal medicine series, I uploaded atrial fibrillation lecture management properly. So if you didn't watch, you can watch that video. Okay, so now how we can differentiate with normal sinus rhythm and atrial fibrillation? So here only everything normal. The P wave and the rhythm we can see change. So in normal sinus rhythm, we can say P wave will be present, regular rhythm and equal RR interval, and usually narrow QRS complex, and stroke risk will be like normal. But in atrial fibrillation, the P wave will be like absent. The rhythm will be like irregular rhythm we can sing, unequal RR interval you can sing, and QRS complex usually normal, no change, and the stroke risk will be like increase. Okay, so how to recognize? We have to ask ourselves, are there P waves present or not? If it's no, is the rhythm is irregular or not? If it's yes, then we call that is atrial fibrillation. So in conclusion, the hallmark of atrial fibrillation in ECG findings, we can see irregular rhythm, and the P wave will be like absent. the stroke risk will be like increased due to thrombus formation in the left atrial appendages. The common causes we can say hypertension, mitral valve diseases, heart failure, hyperthyroidism, alcohol, and sepsis. Okay, so these are the main things. So excellent. Today we learned how to identify atrial fibrillation and how to recognize its classic ECG findings and understand why it carries an increased risk of stroke. So in upcoming day 18 we will learn about atrial flutter, including its classic sawtooth ECG appearance, causes, and how to differentiate with atrial fibrillation. Okay, so if you didn't watch our previous videos, you can watch that videos, because if you're following that series step by step, then you will get good idea about ECG, how to do interpretation and everything. So see you in our next lesson of MedSteps.